Welcome to Soul Science, where your no BS dose of mind, body, healing, health, and wellness occurs. I'm Jacqueline Kane, and I get to hang out with Dr. Liz Lehman. And so, hello, Dr.
Hello.
Liz. She's peachy in her peach.
That's right.
So today, I know we had tried to record this last week, but we're going to record it today. Technical issues, that's what happens. So last week, I had the pleasure or the not pleasure of having to go for a cap on my tooth. I forget the wording. And it was quite an experience. I don't have to have a lot of procedures done. I have all my teeth, actually. I never even had my wisdom teeth out. So I pride myself in not having to do it.
Don't have a lot of dental experience there, Jackie. That's the problem.
Yeah, right. So I had this, I have a fracture in one of my teeth, and they were like, at some point you're going to have it capped. And I'm like, okay. So it came time. And last week was the week. And it was so devastating to me how dentists treat people in the dentist chair. And since then, I've heard even more stories of how we're just like a slab of meat on the dentist chair. So I go in there, and the dentist didn't even really say, I'm going to give you a needle now. You've got your mouth wide open, and it's coming, and you see it, you cannot see it. And I'm like, oh, I'm getting a needle. Oh, and there's the next one.
Oh.
It wasn't too much of, how you doing? You okay? Like,
right.
I was just floored. And then she's got, they've got all this stuff in there. And you know what? Thank God we have what we have, right? To take care of our teeth. I mean, it's incredible what we have.
Yeah, we have good teeth in this country.
Yeah. But then they start talking about COVID and all the negative things. And I'm sitting there with my mouth wide open and all that. I'm all about energy, right? Like, focus on the person who's in there, who's in your chair.
Yeah.
And I get it, because I used to take x-rays. So I understand. We would say there's an arm out there, meaning there was an arm attached to a person to x-ray, right? But we dehumanize the patients when this happens. And you gave me a little bit of insight of what's it like for doctors when you guys go through your education.
So in medical school, because that's always happened, and it sounds terrible. The doctor didn't care for me as a patient. There is a reason for that, because as a physician, you see the worst possible things that can happen to your fellow humans. I mean, the traumas, the emotional pain, like talking to a family member as their loved one's dying right in front of you. I mean, you see bad stuff, telling a parent that their child has like inoperable cancer. I mean, it's bad stuff. Like, it would just break you down every day, and then it's horrible. Yeah. So as that provider in that world, you do put up a wall. You have to protect yourself. You compartmentalize everything. Yeah. It really sucks going out and talking to the family that, I've had to do it, where their family member didn't make it out of the OR, that they died in there. And you can't shed tears for all of that. You wouldn't have anything left inside, honestly. So
and you were the one who had to share the information?
Well, often, yes. I mean, the surgeon and I would go out there, and, or I would, just see them myself also, because if the surgeon was busy, and I'm not keeping people waiting, if, normally it would be a united front, and to try to explain everything that happened, and whether it was surgical, it doesn't matter how or what happened, but just what measures were done to do everything we could. But I remember there was a time, it's like 3 a.m. I wasn't even on call. I was the backup call from home.
Mm.
But the anesthesiologist that was on call calls me and she goes, oh, this is going to be a bad case. And I'm here setting up the room and nobody else is here yet, but can you come in and help out? So I'm like, yeah, of course, I'll come in and help out. It's my job, even though that's, normally not what we do. Anyway, I said, okay, you get all the blood stuff, you get all the lines set up, you go set the room up, I'll go check out the patient. I check out the patient. The surgeon had already been there, and the patient's in the intensive care unit. They had like massive bleeding in their belly.
Mhm.
And the surgeon said, you need to go to the operating room. This person was still aware. They were still breathing on their own. They were awake. He was maybe like a 65, 70-year-old man. His wife was there at the bedside. He was in extreme duress. Like his numbers were horrible. His lab numbers were horrible. He'd been bleeding out for a long time. He had a whole host of other medical problems. Like his belly was all distended. There was like dead bowel rupture and bleed. Like it was just,
Oh, wow. Yeah.
this man was
There was a
going
lot.
to die. His like blood pressure was so low. And again, it's a dehumanizing expression, I'll tell you, but when we say somebody's circling, it's like they're circling the drain. Like you do have to make it with a little levity and a little bit of humor because it's so horrible, right? Like this is so horrible. And of course the wife was asking, he couldn't really, talk much. They were just sitting there holding hands. And so she says to him, what do you want me to do? And he just kind of shakes his head. And then she steps out of the room and talks to me. And she said, well, what's going to happen? What are his chances? And I was honest. And I was like, he's going to die. And that sucks.
Yeah.
It's a bad position to be in.
It is. It is.
But I wanted her to know the truth because I knew, having worked with this particular surgeon before, who did not explain things to patients and would take people to the operating room and do what he may have thought best for, but not maybe the right reasons. And she was owed that. So I said, your choice is this. You can have him die with you sitting next to him and him without a breathing tube in, and you can be together, or I will take him to the operating room. I will put in a breathing tube. We will put in lots of IV lines and he will die in there. Because the second he was going to make the incision, like it was bleeding internally. You don't have that pressure to keep any of the blood in your heart and vessels. He was going to have a massive heart, like he was going to die.
Yeah.
So I said, this is your decision. I was like, I'm happy to tell you exactly what we will do, but it's ultimately your decision. Like, how do you want to die?
Not a win-win situation.
Not a win-win situation, but because of those instances, which fortunately in medicine and in so many specialties are very few and far between, where you can pick and choose a specialty that you don't have that conversation, like pathology. If your patients are already dead, they're dead, right? Doesn't matter. This sounds bad, but they kind of are a slab of meat. Like your soul in person has transitioned.
Yes. Yeah. Yeah.
A physical body, or cells on a slide. It's, there's no emotion or feeling there. That is like the only one where you don't have to have a wall. But I will tell you, all the pathologists are weird that I've ever met. No offense to any pathologist who may be listening. Totally normal and like so great, and we could be besties and hang out. Probably shouldn't have said that, but they're a little different, as I said. But actually, so are anesthesiologists. We're also a different breed. But yeah, that's why I think it becomes ingrained in providers to detach and to sort of treat that patient as like not a human so much. And I know when I was starting in medical school, they were trying to really have that conversation and make you be more aware of engaging in dialogue and being respectful and communicating.
Yeah.
with patients and treating them like people. I mean, in your situation, first of all, it's not good. And I know you were taking in all their bad energy and they should have been acknowledging you, but I kind of hate when the dentist is talking and I go like, wait, then they're like, what are you doing this summer? Are you going on vacation? And you're like, like, you can't talk. I can't answer.
That's exactly what it was like. And, I'm like, oh my God, I'm not even here. And I used to take x-rays, so I totally get it. When we had to do biopsies, the woman's there. We took so much time to say, how are you? We would engage her in the conversations. Granted, you can't at the dentist, but there's ways, right, to be aware of the fact you're ignoring the person that you're working on.
Yeah.
So thank you for that insight, because I hadn't thought about the doctor, and I totally get that they're going from one case to another and they don't have time. And even this dentist, I'm sure she didn't have time to like say, hey, how are ya? I'm gonna give you a needle, it's gonna hurt. And to get, they were probably booked one after another. And we don't give that time for the nurturing, for the caring it takes to help somebody transition. But the other thing that I was thinking about was, what about the people who have had trauma about not speaking up? And here they are, all of that. I've had trauma in my life. So I was like aware of that as it was happening. It was a very surreal for me, but I know there are other people who have had even more trauma, and you put them into that situation. You could stir that up, and maybe that's even why a lot of people don't even go to the dentist to get their teeth cleaned.
It's probably very true. I mean, because you are so vulnerable and different than like the operating room. I mean, you're wide stinking awake. I mean, I know there's sedation dentistries. I don't know how exactly they do that or what's, done. I've just heard them advertise. But, in the operating room, almost, I would say over 90% of the time, you are heavily sedated, 100% asleep under some sort of anesthesia. Although I will say there are times when you do something under local, and because everybody who works in the operating room is used to the patients being under anesthesia, they talk about, their own things amongst them. And as the anesthesiologist, we are a local, just meaning they're doing the local anesthesia wherever they're working, only the patient is wide awake. But a lot of times in those cases, they would engage the patient in conversation too.
Right.
But yeah, in dentistry, you're really vulnerable. You're sitting there and you're not able to communicate.
Yeah.
I mean, I have had dentists before but it's more for a pain thing, not like for, let me know if I guess there's like, let me know if you're okay, raise your hand. Those guys, I think, are few in guys and gals. And I say guys in a gender neutral way. They're few and far between.
Yeah. And at the end, I really had to say to her, next time, can we just talk about rainbows and unicorns?
Yeah.
Like, for those of you listening, you can really speak up. And I had a dear friend who went through cancer this past winter. And I was like educating her, when you go in, you tell them you have the right, and I'm giving all of you permission out there to go to your doctor and have an agenda, ask them questions. Don't just sit there and say, okay. Ask questions and say, talk about your fears, talk about what your desires. I remember when I was pregnant with my kids and the doctor was like, okay, we're going to do a C-section. And I was like, oh, all right. I really didn't want a C-section. I really didn't want that. I worked in x-ray, so I knew everything that went on in the OR. I'm like, I don't want that. And when I went in, the nurse was like, well, then tell them. We'll induce you and see how it goes. And I was able to be induced. It took long, but you have the right to speak up. You have the right to speak up.
There is a little bit more awareness about that now, and there are patient advocates out
Yeah.
there, but 100% true, because in medicine, you've got doctors, nurses, like staff, aides, everybody is overworked,
Yeah.
underpaid, on a time schedule. Like doctors in the
Mhm.
office, the insurance companies are mandating you see so many patients and you are allotted, like you are only getting reimbursed for your 15-minute like follow-up. Now, I would say almost every physician I know as an office-based practice is perfectly fine with spending more time.
Yeah.
But that's the mindset. So when you have your questions and you need something repeated, or you're not comfortable with it, or want alternatives to how to treat the problem, instead of, okay, yeah, good. Okay, here's your prescription. And it's in the computer. And okay, I'll see you in 6 weeks.
Mhm.
No, you have the right, and you do have to speak up, whether that's like in an outpatient setting. And I mean, I say this, and I say this like to my family members going through a hospital event or whatever. I'm like,
Yep.
you need to speak up. You need to almost raise hell to get attention,
Mhm.
because
Yep.
those nurses on the floor are so overwhelmed and
Yeah.
taking care of like 30 different patients and doing their charting and relying on the aides. I'm like, you're having pain, you need your pain pill now. Just
Yep.
make it happen. You don't want this test, you have the right to say no.
Yeah.
Just don't blindly follow and sit there, because and especially if it's like you're feeling short of breath or you're feeling uncomfortable, but oh, they're so busy. No, you gotta let them know. Or like you said, if you had a trauma in your past and they don't know that, nobody in that office
They
knows where
don't.
you're coming from. They don't know your
Yeah.
fear, and they can approach you an entirely different way if that office's staff is made aware. But
Right.
it's a
Right.
communication. So it kind of goes both ways. Like, yeah, the medical people need to communicate a lot better with the patients for sure.
Yeah.
But they also don't know your point of view, like what you're bringing to the table as well, unless the patient communicates it.
Yeah, absolutely. It does go both ways. And people really need to know that they have the right to speak up,
Mhm.
that the doctors are not God, nobody is God, and that you know what you need inside of you. And don't let anybody tell you that you don't. Trust your instincts, trust your gut.
Absolutely, because, and I say this, preach this all the time, like, you know your body better than anybody else, better
Mhm.
than anybody else. If something is not right, you just feel not right, you just keep going back, and you be a pain in the ass to whoever you need to do and raise hell, because you know your body. Until you get that diagnosis, until they run the right test, because
Mhm.
sometimes it's not always so easy to
It's
differentiate
not.
what is
Right.
what. And maybe at one point that test didn't show it as a positive finding, and now it is, but it gets ignored if you don't speak up, honestly.
Mhm.
Or you're just like, oh, well, it was negative. Okay. Or, oh, it's probably this, it's probably that. I'm like, oh, really? No,
No.
that's how bad stuff gets missed.
Yeah. Yeah.
That's crazy.
Yes. So everybody out there, speak up. Let us know what you think of this conversation, if this is resonating with you. And thank you for being here. Thank you for watching.
Yeah. Until next time.
Bye.
Bye.